3, go.
I want to tell you about a girl mentioned in Time website, which I visited on June 20th, 2011. Her name is Hannah. Hannah has been to several therapists, nutritionists, and teachers, but still has made unintelligible utterances and echoed dialogue. Doctors believe that she is suffering from retardation. In October 2005, Hannah was introduced to a specialized computer. She was asked if there was anything she wanted to say. The girl thought to be incapable of learning typed, "I love mom." She is clearly not retarded. She is autistic. I am going to discuss autism and the influence that it has on speech. Autism is very common among our children, and you never know when you may come in contact with someone with autism. Having knowledge of the disorder will impact how you address them. I have done research and obtained some information about autism from the book, The Everything Parents Guide to Children with Autism by Adele Tilton, the Autism book by Robert Sears, MD, the website WebMD, and the National Institution of Neurological Disorders website. Today, I will inform you of autism, what autism is, the signs and symptoms of autism, and treatments of autism. In order to diagnose a child with autism, you must know what it is. According to Robert Sears, MD, author of the Autism book, 2010, autism is a neurological medical disorder in which parts of the brain that control communication, behavior, social interaction, learning, sensation, motor coordination aren't functioning properly. Each person with autism is affected differently. Some will display a few of the symptoms, and others will display many or all of the characteristics. There are 4 kinds of autism. It is important to understand the different types and how they present. The first is early onset autism. It's the belief that a baby is born with autism. They don't develop the typical eye contact, the social interaction that they should during the first few months of life. This is the least common autism, accounting for less than 10%. Regressive autism is when a child seems to have normal development. They are playful, happy, interactive during the first years of life. They begin to lose the milestones that they have built. Words become less. They lose eye contact and social interaction. This is the most common form of autism. Halted progressive autism is normally developed in children. They don't regress, they just stop progressing after the age of 1. They do not lose any milestones. This is harder to detect. Most children who are diagnosed with this are between the ages of 2 and 3. Asperger's syndrome is known as the high-functioning autism. Most challenging to detect early on because kids with Asperger's develop a near-normal manner in regards to language, advanced intellectual skills, but there's always something a little different or off about their behavior. Most often children who enter preschool is when the social dynamics become more complex and lack of understanding becomes more apparent. For toddlers that show signs of autism but not enough symptoms and development delays to give evaluation are diagnosed with PDD-NOS, pervasive development disorder not otherwise specified. Toddlers with PDD-NOS can develop any of the 4 types of autism. 1 in every 1,000 children have autism. 70 to 75 suffer from mental retardation. In order to control or reduce undesirable behaviors, knowing symptoms, signs is a good hallmark for managing the disorder. Autism has a set of many signs and symptoms that appear differently in each child. The number one thing to remember remember is that when you're considering a child with autism, his signs and symptoms may be different from another child's signs and symptoms of autism. According to Adele Tilton, author of the Everything Parents Guide to Children with Autism 2004 book, children with autism exhibit the following symptoms that characterize all autism spectrum disorders. The symptoms include lack of eye contact, toe walking, no fear of dangerous situations, bothered by large crowds, inappropriate crying, overly sensitive, have outbursts, hyperactive or passiveness, inability to relate to other children, poor speech or no speech at all, are just to name a few. In the DSM-4R, criteria has been established to make a diagnosis for ASD. The DSM-4R is published by the American Psychiatric Association. This is the manual used to diagnose all mental diseases and disorders in the U.S. A parent, guardian, or doctor can use the descriptions of the DSM-4R to determine if a baby is autistic. After reviewing the signs and symptoms and properly diagnosing the child with autism, the next question is it curable? Unfortunately, autism is not curable. According to WebMD, which I visited on June 17, 2011, the exact cause of autism is unknown. But research has pointed to several possibilities such as genetics, environment, certain types of infection, and problems occurring at birth. Studies of people with autism have found abnormalities in several regions of the brain, suggesting that autism results from disruption of early brain development during the fetal period, causing defects in genes that control brain growth and regulate how brain cells communicate with each other. These findings do, however, need further study. Neurological disorders suggest that even though there are no cure, it can be treated. Stated in the National Institution of Neurological Disorders website, which I visited on June 17, 2011, therapy and behavior intervention can bring substantial improvement in the way autistic children cope with this disorder. Educational and behavior use highly structured, intensive skills-oriented training sessions that offer speech, language, and picture exchange to help develop social and language skills. Medication is prescribed if there are specific autistic-related symptoms such as anxiety, depression, obsessive-compulsive disorder, antipsychotic medication to treat severe behavioral problems. Medication to treat people with attention deficit disorder can be used to decrease hyperactivity. One of the most popular treatments is GFCF, which is a diet, a gluten-free, casein-free diet by eliminating food such as wheat, rye, barley, milk, and oats from a person's diet. The theory is that the body may have toxicology response to the molecule of gluten, and that the central nervous system behavior is affected by the structure of casein molecules is similar to gluten. By maintaining this diet, you will have positive results. The most difficult thing to absorb, the most possible thing to absorb is the doctor advising you that your child has a disorder, especially if it's incurable. Today I discussed autism. I explain what autism is, the signs, symptoms, and how to treat it. If you want more information on autism or ways you can contribute to finding a cure, I've listed some websites that may be helpful, and I hope you all take heed. And some fun facts about autism. Dr. Leo Kanner was the first to write about autism in the 1940s. Autism originated from the Greek word autos, which is spelled A-U-T-O-S, meaning self. It was named autism because it was believed to be an excessive preoccupation with oneself to lack the love from one's mother. And also, the CDC reported that during 2000 and 2001 school year, more than 15,000 children ages 3 to 5 and more than 78,000 children ages 6 to 21 years old in the United States had autism. Boys are more likely to get it than girls. And that's all.